Information is power, and I'd like to introduce you to a powerful community health management tool called Community Ahead. This powerful, user-friendly database will give you an up-close and personal look at health conditions affecting our entire county, right down to what's going on in your neighborhood. The training video that follows will introduce you to the Ahead tool and provide you with a brief tutorial to help you access a wealth of useful health information. As always, please call on me or my team for assistance using Community Ahead, or for any other health concerns in your community. We're here to help and anxious to hear how you use this new, exciting tool to improve the health of your neighborhood. Thank you, and please stay healthy.
Let's begin by reviewing how to access the tool. First, visit our website at hamiltoncountyhealth.org. Scroll to the bottom of the page and click the Community Ahead program. This will navigate you to the Community Ahead tool. There are several indicators currently loaded into the system. These health indicators are grouped into the following classifications that appear on these green buttons on your screen: maternal and infant health, mortality, communicable disease, and injury. The data used to generate Community Health Ahead statistics come from a variety of public health surveillance systems. There is absolutely no personal health information shared in this tool, just community-level health statistics. During this tutorial, we will dive into maternal and infant health statistics. Note that if you hover over the green button, a message will appear indicating the last date the indicators were updated. The maternal and infant health data were last updated in December of 2011. Let's go ahead and click the button. If you're searching for information related to birth outcomes, this is the button for you. Poor birth outcomes are certainly very sad events and can be important indicators of the overall health of a community. The indicator list is located in a drop-down menu at the top of your screen. Click the arrow to access the list of available indicators. Low birth weight, preterm birth, rate of babies born to teen mothers, the rate of babies born to mothers older than 34 years of age, and just the general birth rate for each community. So let's select the preterm birth indicator to walk you through using the tool features. The definition of preterm birth appears in the green banner at the top of your screen. The preterm birth rate is the percentage of babies born before 37 weeks gestation. Preterm birth is a leading risk factor for infant morbidity and mortality. The first feature that appears is the bar chart. See the button at the top called Chart. The chart displays community-specific bars in green that are sized based on the rate of preterm birth. The larger the bar, the higher the rate. Notice the county rate is presented by a blue bar. You may consider this the expected rate for our communities. Let's sort by rate so that we can identify the communities with the highest rates of preterm birth in Hamilton County. Click the top of the rate column in the mini table on the right. Now simply scroll down and explore. Notice the bars get larger as the rates increase. Hover over the bars to view the rate more clearly. Notice that certain communities do not have a bar. Let's find out why. If we scroll to the bottom of the mini table on the right, we see that each of these communities are suppressed, represented by an S in the rate column. You can read information within the Data Sources button to learn more about suppression. In some, numbers that were too small to report reliable rates or didn't meet our data disclosure policies were not included in the tool. To view the map feature, click the map button at the top of your screen. You will see a map of Hamilton County. As you hover over each city, village, or township, a message box will appear with the jurisdiction name and indicator rate. Click the Legend button at the top of your screen. This shows the colors associated with the rates on the map. Darker blue areas correspond with higher rates. In this example, a preterm birth rate of 15.8% or over received the darkest shade of blue. The map functions like other online mapping products. Zoom in and pan around all you want. To view time trends, click the Graph feature at the top of your screen. This button takes you to a time series chart. This feature shows the rate of preterm birth over time. The lines show change between the 2004 and 6 period and the 2007 and 2009 period, shown on the x-axis of the graph below. The default lines are for Hamilton County and the city of Cincinnati. You can add as many lines to the graph as the system will allow. Click the box next to the place name to change the color. Keep in mind that many factors such as small numbers can influence the changes in rates over time. The appearance of an elevated trend does not always indicate a true public health problem. Just as with the other features in the Ahead tool, the table is sortable by rate or community. Hover over the points to see the community name and the rate for that period of time. Finally, click the Data Feature button at the top of your screen to view rates and numbers when available. Do you want to download this data yourself? Well, go ahead and click the Get Data button. The Get Data button allows you to download a CSV file which can be imported to almost any analytical program such as Microsoft Excel, SPSS, or SAS. Each of the different tool features gives you a unique look at the data. If you discover a specific finding that you'd like to share, simply click the Share Link button. Select the Copy to Clipboard button. And then simply just paste the link in your email. How about sharing a report? Well, you can do this too. Select the Include in Report button. Next, select Generate Report. The system will then generate a PDF file that you can store anywhere on your computer. You should note that the feature functionality that I've described to you for the preterm birth indicator is also available for several other health indicators in the area of injury, which includes indicators such as falls and motor vehicle accidents, communicable diseases that include indicators such as sexually transmitted infections, and mortality that includes standardized mortality ratios for specific causes of death. Thank you, and this concludes the Community Ahead tutorial. Please feel free to contact us with any specific questions. Our contact information is located on the Epidemiology and Assessment website. Thank you and have a healthy day.